Hello, everyone. Today is Thursday, April 23rd. It's our briefing for today. I've got several things I can go through fairly rapidly, I think. The best thing is just this. We've not lost any more West Virginians, and I hope and pray that we'll stay right there and everything. Naturally, we've got to always be concerned and know we've still got a few people out there that are still sick, and probably some more that will get sick. But we've, thank goodness, we haven't lost anybody else since yesterday. I want to report on our workforce group, Workforce West Virginia, and the National Guard's help with them, and all the great people from Scott Atkins to all the people that have done all the incredible work in getting us caught up. We've now received over 150,000 unemployment claims since March 1st. It's unbelievable. I mean, if you just think in years past, a typical March was 3,400 people. We've received 150,000 claims in the last really month and a half. Today, I am announcing that we've done exactly what we announced that we're going to be able to do. We have now cleared the backlog completely with these claims. Now, there are some claims that need some manual work because the claimant has listed an incorrect business address or other types of personal information that we need to backfill and get straight. But Workforce is dealing with these individuals and calling them and dealing with them on a personal basis. And so, again, I can't say enough for how we've pounded a massive round peg into a square hole in West Virginia and been able to punch out all these claims. I hate like crazy that they didn't all come out on day one, but all the people that were sitting at home worried and everything, at least I hope there's real live relief coming your way, and all your dollars are going to be backfilled and taken care of. I also want to announce that the self-employed workers and independent contractors will go up tomorrow night at 10 o'clock for your applications, and we'll move right along on that. I think you've got that on the screen, and if you'll take a good look at that. We did get rules on the dollars, the $1.25 billion that have come in. The rules do not give us the opportunity to backfill revenue as they stand today, but those rules we feel like are absolutely going to move in our direction. And we think that that's probably a 10-day to 2-week process to get across that finish line. But as the House goes through their gyrations and everything, we feel like, in the Senate also, we feel like that this is still a real possibility for us to be able to backfill the lost revenue dollars. But there's so many other things we can do. This is all, I feel real confident that this is all going to work out really well in our favor. As far as our nursing homes testing, they're doing great work. They're right on track and everything. They're going to probably spill over into next week, to midweek type basis and everything to wrap everything up. But they've done amazing work in testing all of the nursing homes, and they're proceeding ahead very, very quickly there. A monumental task, if you think about it. We had tested 22,000 people in 40 days, and now, we're going out and we're testing 28,000 people, and in a very, very, very concise period. If we started on Monday and we really went through a business type week and everything, we'd be spilling over into the first days of next week if we went to calendar days. And so they're doing great. They're doing great, and they're really moving along very, very quickly, and we're getting better results than what I really feared. And this program, with West Virginia being the first in the nation to do it, you see, if you watch the national news and everything, CDC and everybody is coming out saying we should be doing this on a national basis, and And the other thing is, once we complete this, you know, this will spill right over into our assisted living areas and so on like that, where we'll be able to test more and more. And I commend everybody that's involved. You know, DHHR, all the healthcare workers, National Guard, everybody that's doing the great work, as well as LabCorp. And LabCorp's really stepped up and given us the ability to test a great deal more. And so there's lots of good stuff going on there. I guess one thing, you know, from an economic standpoint, I want to jump back to is the Roads to Prosperity update. We have thus far awarded $216 million worth of work. There's tons and tons of stuff happening in the highways and transportation departments. There's going to be a release that's coming out real soon, and it'll be online about our paving season. You know, we're going to absolutely jump on every pothole, every pulling of every ditch, and we're going to just stay after it until we get this thing across the finish line. You know, if I could just say this, we all know that our roads got in this condition by decades of neglect. And we've absolutely gotten right after this. I commend again all the great West Virginians that went out and voted for this Roads to Prosperity program. I told them we wouldn't raise your taxes. We haven't raised your taxes. We have absolutely just done exactly what I promised you, and it's worked. And so I commend, you know, our Secretary Bird White and our Deputy Secretary Jimmy Riston and just all the really great stuff that's going on there. You know, I do want to tell you this, you know, and maybe I'll tell you now, but you know, I've said this 1,000 times to you, but we tested our nursing homes at Barbersville, you know, our vets nursing home there, and we came up with one positive, and we now have other outbreaks in different places, and we have and explain to me what that is. Yeah, well, it's the bottom line is when we come up with one positive, we prevent the possibilities from having outbreaks all over the place and everything in that facility or in another facility. So we isolate and we jump on it with both feet and we take care of it. Now with that, let me tell you this, and you know, by looking at me, and I don't want to take a bunch of your time with this, but last night, I mean, if you look at me, you can tell I've got to be tired. We're all tired. But last night, you know, I signed off at 1:49 in the morning, and the reason I did, I was captivated by this movie that was on that was called The Last Full Measure. And I thought, well, I'll just watch just a second of it, and I just couldn't quit watching it. And what it was about, you know, a Medal of Honor recipient that many of the people that fought in Vietnam with him had no closure in lots of ways to their life, and they had decades of demons and bad things happening in their life and everything. They wanted this so badly, as did his mom and dad. He was an airman, you know, an enlisted man that only 3 in history have ever received the Medal of Honor, and he had been turned down. He lost his life in a battle in Vietnam. And it went on and on and on, and in the closing of the movie, it had probably 400 people in a hangar where he was receiving the Medal of Honor or being the recipient, and it was being presented to his mom and dad. And at that time, and again, you know, it's 1:49 is when I signed off, but, you know, I'll never forget, I think Jimmy Valvano said, if 3 things can happen in a day in your life, one is something that would bring you to laughter, and another would be something that would bring you maybe to a deep thought. And I think that's correct, and I could be wrong about that. But the other is something that could bring you to tears. In watching that at the end, they recognized how valuable a life was. They asked all the people that were there that had these demons for decades would stand. And then all the people that knew them, And then any veterans that were there, anybody that was in the military, or any friends of this family and everything, and they all ended up standing. And they said, you see what the devotion of one life can do, how it touches us all. And I would just say this, and that is, for me, I have said so many times we owe every single thing in our lives, everything, to these men and women that have protected us and done all the great stuff that they've done, the active military, our veterans, all the people that we've lost, all of those. And what they go through is unbelievable. I would really challenge you all to watch that movie and everything, because in that thing, the point that I was sitting there with tears in my eyes about was just simply this. As much as I know, I still have room to appreciate them more. And for that, I am absolutely wanting that to happen within me. And I know so many of us don't appreciate enough what all they've given. And so, I'm happy we only had one at our nursing home, with our vets and everything, but watch that movie. It'll make you realize an awful lot about just how much they've given. And how often, so many that have given so long ago can't turn loose of situations that they had to go through for us. So anyway, watch that movie. Think about me at 1:49 in the middle of the night still watching it, but I'm really glad I did. I want to recognize the great work that our Commerce Department's doing, in regard to our small businesses. We have processed, or we have assisted with nearly 2,000 businesses in the state of West Virginia as far as helping them and guiding them through the wickets. And Secretary Gaunch is doing a great job there. There's all kinds of stuff that we have up on our website and everything to be able to help small businesses. And I think we're going to very, very soon have another tranche of federal money that's opening up to where the small businesses situation, there may be some that tried to apply, that were told the money ran out and they couldn't apply, and they thought they may have been left holding the bag. But I think our federal government's going to come through and put another almost $500 million out, or $1 billion out there to be able to cover the small businesses that we missed on the first go-round. I want to say this, that in our jails, we have continued to test, and we have 0 positive cases in our facilities at this time. It is remarkable, and another tribute to all the correctional officers and the Department of Corrections and Jeff Sandy and all the juvenile system, justice system, for keeping these prisons safe during this terrible pandemic. Just to give you something to compare to, in one Ohio jail, they have 2,000 confirmed cases in one jail. We don't have any confirmed cases in any of our jails in West Virginia at this time. So many kudos to all these people. As far as our ability to become self-sufficient and in lots of different ways, we're making masks, and I've highlighted the great work the National Guard's done on this, but there's been lots of individuals, there's been lots of you helping out as just good West Virginians and making equipment, making masks and everything, and trying to donate food and donate your time and everything that you've done great work on. And it's a true mountaineer spirit. I just love you in every way for it, and just keep doing the great work you're doing. And I guess the very last thing that I've got is to remind you again about the census, if we could put that up there, that be counted. We need you to be counted, because every dollar, how many times do I have to say this? But every dollar that we can bring into the state of West Virginia, every single dollar is what I'm after. Every dollar we can bring into the state of West Virginia through federal funds and everything that we may miss, that's what we need to do. So the net of that is that is this: be counted and celebrate the fact that please always try to remember a vet and remember the active military for what they sacrifice. It's unbelievable, and be thankful today. We've not lost any more West Virginians, but thank you so much.
All right, thank you, Governor. We're now going to take comments from a few of our panel members. Up first, we have Major General Hoyer with the West Virginia National Guard.
Good afternoon. Today we have 704 men and women on duty in the National Guard supporting this effort. Under our 4 lines of effort, I'll highlight a couple of key things. Under operationalizing the event, today we are testing at the 4 state nursing facilities, and we will test at 1 additional facility tomorrow. The 5th facility is doing its own testing, so all 5 of the state nursing facilities under the support to DHHR and the great work that their staff is doing will be completed by the end of this week. Want to highlight a couple of things under population stabilization. We continue to work with the food banks, the counties, VOAD, and other volunteer groups. As of yesterday, in support of those organizations, the National Guard has delivered 140,000 meals since the start of this effort. In addition, on behalf of Governor Justice and all of us on the team, we want to thank the many businesses who've donated over $1 million in in-kind donations and supplies. In our press release this evening from the National Guard, we'll highlight many of those organizations. And again, on behalf of the governor and all the team, we thank them for their support and their effort. Under logistics, we delivered to 10 counties yesterday, and today our primary effort has been on securing 14,000 swabs to meet the requirement for the rest of the testing for our nursing home facilities through the rest of the week, as the governor's outlined. Under innovation, as the governor pointed out, a number of organizations are working to support the efforts. A group known as the Mask Army has produced over 15,000 masks and have already shipped 6,000 of those masks out to various organizations. We continue to sanitize emergency response vehicles as well as public transportation vehicles and equipment. And to date, we have provided training and support to over 646 businesses and 56 medical and long-term care facilities in training in PPE, sanitization, and other efforts to allow for us to slow the spread of this virus. Under data analytics, we continue to work with DHHR and the Health Department lab in order to ensure that we have the appropriate numbers of personnel going forward for contact tracing and data analytics, which we believe will be an ongoing mission throughout the various phases of this pandemic. Again, on behalf of all the members of the Guard and Governor Justice, we thank the citizens of West Virginia for the great work that you continue to do to help us reduce the spread of this deadly virus. Thank you.
All right, thank you, General. Up next, we'll go to Dr. Clay Marsh, our coronavirus czar.
Thank you, and it's wonderful to be with everyone today. I have a few comments. First of all, there's an accelerated amount of work around the world to test some new vaccines, and that's just the first step, but it's encouraging that that work is pushing forward quickly. Second of all, not only the CDC in the US, but Canada has also moved to looking at their vulnerable populations, their long-term care facilities, as the governor has sort of set the standard here in the US. So this is a really important opportunity for us to continue to evolve that strategy. And to do that, we need greatly expanded testing capacity. I think it's important that we have tremendous facilities in the state of West Virginia, and we certainly are using those facilities and will continue to do so. But to augment the testing in the way that we want to do, which opens up that testing in a much less limited manner, we do need a national partner. And we have chosen LabCorp, as the governor has said. Now, the key for LabCorp is that they do have 350 people here in the state of West Virginia. And the lead person for the diagnostics group is also the chief medical officer, is a 2-time WVU graduate and West Virginia native, Brian Cavney. And Brian has really helped prioritize the needs and the goals of West Virginia in front of other places that are equally asking for their help. So we are very cognizant that we want to keep all of the resources that we are expending in the state of West Virginia to all levels possible. But we also want to really open up the ability to test broadly. And LabCorp has a great distribution chain, including the materials, the swabs, and those things that we need to really expand testing, even past the long-term care facilities. Otherwise, West Virginia is doing well. We're certainly watching the number of new positive cases. We're recognizing when we start to look at community spread, which is really an important marker for us as we enter phase 2, that our border areas are the ones that are the most susceptible. Certainly looking at the Eastern Panhandle that's adjacent to the Washington, D.C., Baltimore area, which is an area that is really become a hotspot. Certainly around Mon County, which juxtaposes against Pennsylvania. And then some of our bordering areas with Ohio are the places that we're watching the most closely and have the most activity. And ultimately, as we include testing our vulnerable population, because again, remember, 70% of people who spread are either undiagnosed or asymptomatic or pre-symptomatic. So identifying these people with spread is important. Governor pointed out the interdependencies of all things. That's the butterfly flapping its wings in South America affecting the weather here in West Virginia, that a single person who is undetected, as we saw in South Korea, which was patient 31 in South Korea, was responsible directly for infecting over 5,000 people. So the more we can identify people in these areas where we know we have more activity, and certainly in areas where we have vulnerable citizens, the more we can design strategies to reduce that spread and protect our population in a much more precise way. So thank you.
All right, thank you, Dr. Marsh. Next, we'll go to Secretary Bill Crouch with the West Virginia DHHR.
Good afternoon, everyone. The governor talked about the nursing home testing. Let me give you a little bit of detail on that. 36% of the facilities we've initiated testing in have resulted in a lot of tests going to the lab. We're still waiting on a lot of those reports, but we have 47 that have initiated testing. 23 have completed the testing and have results pending. We have a total, however, of 2,116 negative tests thus far through our testing. We have 4,211 tests pending at this point. That number will continue to grow, but will come in constantly. So we will see our numbers go up very significantly over the next few days. I want to mention 2 orders that were filed yesterday by the DHHR's Bureau of Public Health. These rules will go into effect immediately. The changes allow for the collection of data that will assist us in making decisions. The governor talks constantly about data and accurate data and transparency. And these 2 orders move us a little bit further along in making sure that we get that. One of those is a requirement that individuals who die with the disease are reported to the Bureau of Public Health. The other is a rule which allows us to provide data publicly with regard to nursing homes that have positive COVID patients. So we're working to get that up on our dashboard so that information will be available for the public to see. Again, we believe in transparency. We're trying to be open and provide information as we get that. And we appreciate very much the providers, the owners, and the CEOs assisting us with that. And again, I want to mention the employees themselves who work on the front line with those residents and go into those buildings every day. We can't thank you enough for what you do there, and we thank you for that.
Okay, thank you, Secretary. Once again, we're holding today's briefing with media members joining us virtually to practice good social distancing. First questioner we have today is Kenny Bass with WCHS.
Hi, this is Kenny Bass with Channel 8 and Fox 11 in Charleston. I have a question for the governor or a member of the administration. The Treasury Department has formally released its set of rules regarding CARES Act money. And I know the governor had mentioned that because of the COVID-19 pandemic, West Virginia was projected to be about $376 million in a deficit shortfall, but was hopeful that the federal funds could backfill that money and we'd be all right. The rules released by Treasury specifically prohibit the backfilling of budgets for that purpose. So can you tell me your reaction to what you guys have seen thus far, and if you are still hopeful and optimistic that those rules will be revised so West Virginia can use that money for the budget?
Kenny, it didn't surprise us at all, to see the rules as they've come out so far. The rules are very fluid and constantly moving. There's the stimulus 4 package that's falling out right now, and there's more dollars that are coming. I really do feel like, and I can't go into a lot of the inside baseball stuff that I know, but I really feel like that we're going to be able to weather this storm from a financial standpoint in very good shape. I think that there's a high probability that the rules will be changed to allow the backfilling of the revenue, and I'm very confident things are going to be just fine with that.
Okay, thanks, Kenny. Next, we'll go to David Beard with the Dominion Post.
Hi, David Beard, Dominion Post. We talked today about the more expanded testing and partnering with LabCorp. Do we have a picture of how soon we'll be able to roll out all this expanded testing? And we're talking days, weeks, months?
I think Dr. Marsh can answer that better than anybody, because he's the champion that's worked hand in hand with LabCorp, and so Dr. Marsh.
Thank you, Governor. So, David, it's I think it's a really very important partnership that we have been able to make. And again, our goal is to be able to test a number of populations of people in West Virginia who are more vulnerable for a variety of reasons, and also test more broadly the parts of our state that are having more community activity. As every state is going to have problems with the kind of testing that we would all like to do, which is really at the level almost of population testing. And that's what countries like South Korea did very well. Singapore did very well on the front side. And because of, the requirements for swabs and other supplies, as well as reagents for testing, that local groups that have created capacity, whether it's the state lab or at the universities or the medical centers, or even Q Labs, which is a larger provider in Charleston, are great to serve the state related to looking at contact tracing and clusters and outbreaks. But when it comes to really large population studies where you're talking tens to hundreds of thousands of people tested, you need a partner where they get a lot of resources in a continuous way. And so the help that LabCorp is showing us allows us to be able to really double in almost a moment the testing we have done to the testing we are doing now. We want to expand that even further. So we're really committed to working with West Virginia companies, and LabCorp does have people in West Virginia, but we're also committed to testing very, very broadly. And LabCorp allows us to do that in a way where we can start to think in the tens and hundreds of thousands of tests versus the hundreds and thousands of tests.
All right, thanks, David. Up next, we'll go to Steve Adams with Ogden.
Yes, this is Steve Adams of Ogden Newspapers, and I do want to kind of piggyback off of Kenny Bass's question a little bit. Not only do we have the additional guidance from Treasury in regards to how this $1.25 billion, at least for us, can be used and how it can't be used, but they're already talking about the next tranche of money and coronavirus relief for states, which could possibly include money for budget shortfalls. Senate Majority Leader Mitch McConnell is pretty adamant on not doing that. His remarks seem to be more aimed at states that kind of want to use this as a way to help deal with their pension issues, which largely have nothing to do with the coronavirus, though I'm sure they're exacerbated by it. But he seems pretty adamant about not using this money for budget shortfalls. So I know you don't want to go into the inside baseball per se, but as you would say, you can hope in one hand and have a pile of cow dung in the other. I was wondering if you can give us more information that would kind of give us more insight into what you're hearing from the administration on the federal level.
Okay, Stephen, I can't give you more information, but I can tell you this, that you know, this started down this path. You know, remember there was, I think, $300 billion that was put and appropriated to go to the states. $1.25 billion minimum to each state, and that's what they sent. That was $62.5 billion, okay? So there's a balance still of $237.5 billion that's sitting out there. Now, one of the things, all the states are pushing like crazy to be able to backfill revenue because all of them have got holes that are even significantly bigger than ours. Now, but in addition to that, the states that are the smaller states, you know, are pushing to at least be able to backfill revenue with the first $1.25 billion that came to every state. And then there's additional dollars significantly above all that. Now, as far as being able to give you inside baseball stuff that I have, I'm not going to do that. I would never do that, you know. But I can tell you that absolutely I believe, you know, that we're going to be just fine as far as being able to weather this storm from without having to go in and make drastic cuts or lay off all kinds of people. I don't think we'll have to do either of those. And you know, and I think, you know, that our tax department, our revenue department has worked diligently to be able to be ready if we ever had to do such a thing. But I don't think that storm's coming. I think we're going to be just fine.
Okay, thanks, Steve. Up next, we'll go to Phil Kabler with the Charleston Gazette-Mail.
Governor, regarding belief that the stimulus funds eventually will be available, wouldn't the prudent thing to do be to go ahead and make cuts and transfer rainy day money, and then if at some point the stimulus funds are authorized for budget shortfalls, to backfill at that time and restore the services and that had to be cut?
Well, Phil, now just think about what you're asking. You know, first of all, if you're saying wouldn't the prudent thing be to just make cuts or lay people off, well, it sure wouldn't be very prudent if I was one of those that was getting laid off. And it sure wouldn't be very prudent if in fact what we did that and then had to change courses in 2 to 3 weeks. We're going to know every one of these details in 2 to 3 weeks from today. And we're going to have all the time in the world between there and the end of our fiscal year to be able to do what's necessary that has to be done if, in fact, you know, that there are stumbling blocks. And I anticipate there's always going to be stumbling blocks and everything. And if that be the case, we'll adjust. But to do something now or to do something a couple of weeks ago in reaction to something that we know is going to come out in 4 weeks or 5 weeks or 2 weeks from today, you know, we don't need to do that. That would be silly.
Okay, thanks, Phil. Next, we'll go to Amanda Barron with WSAZ.
Hi there, Amanda Barron from WSAZ. I wanted to follow up. I know ElderCare in Jackson County last night reported upwards of 90 cases of COVID-19 there. I wanted to know if there was an update on the investigation into the situation at that particular nursing home.
Somebody's going to have to get that other than me.
Bill Crouch, yes. This is Bill Crouch. We are investigating that, Amanda. Thank you for the question. I really can't provide a lot of information now, but we certainly will have a report on that when we're done. At this point, we're watching closely and in communication with them, and we will have more to report on that when we have more information on it.
All right, thanks, Amanda. Next, we'll go to Mark Curtis with Nexstar.
Mark Curtis, Next Star Media. Good afternoon, everyone. I'm curious if we have any update on reopening the government or the state, at least partially. Pennsylvania's governor last night announced measures to reopen his state in a large part by May the 8th. Pennsylvania's had 37,000 positive cases and 1,421 deaths. Given the magnitude of difference, if they're opening, why aren't we? We've had far less problems.
Well, Mark, let me just say this, that in the next very few days, you're going to see more and more of a rollout on our side. I would say, no later than Tuesday of next week. But let's just go back to the timetable one more time. Last Friday evening, the president rolled out an idea how to go to phase 1, phase 2, phase 3. To be able to go to phase 1, in his guideline, you had to have 14 days of a stabilizing or the curve moving the way you want it to move. Between that Friday night and the next Monday, we lost 11 people. And we had a real situation on our hands, and that's when I said, go test all the nursing homes. Now, in addition to that, I also said on that Monday, we're going to open up all the elective surgeries at the hospitals, and we put ourselves on a roadmap to be able to do just that. Now, in addition to that, the governor of Georgia, we said we will watch others and adjust adjust to keep our people safe and yet get our people back to work. Now, the governor of Georgia rushes out and says, we're going to do this, 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 and this. And a Republican governor that is running for re-election, I think, and the President of the United States right with him and everything, and all of a sudden the President of the United States comes out and says, wait a minute, what are we doing? What are we doing here? I mean, we're doing stuff way too fast. We're doing stuff the wrong way and everything else. And so it rains on the governor of Georgia's parade. I don't care about the rain. I care about one thing, and that is keeping our people safe and protected and get us back to work. I am trying to do that with all in me as fast as I possibly can. Now, remember, Friday is when this thing started to first move that way. And then from Friday, we lost all those people in the nursing homes, did all the stuff we did. We're working to get our hospitals all up and going and everything. We're talking to all of our business leaders all over the state and a lot of different places and everything, and seeing what we can do and how fast we can move. The other thing that needs to be brought up is just this. In the state of Georgia, they were interviewing a mayor there today that said, even though we have orders for all these different things to open, the people aren't going to open. That's all there is to it. They're just not going to do it. And so with all that being said, now just think about it. Today, if I said today, let's XYZ restaurant, we want you to open. The restaurant owner may say, I'm not going to put my people in that danger. I'm not going to do that today. Now, that's a problem. That's a problem. And there's many of these that you've got to contend with now. But I want to also add just this, and that is this part. I want everybody to understand, and I've said it till I'm blue-green. Now, I'm not going to defend this because I'm very, very, very proud of all the West Virginians and all the great work we've done, and the fact that we're sitting right in the middle of 2/3 of the population of this whole country, and our numbers are unbelievable, and they're unbelievably good. And it's not because, we just happen to be a state that's rural. You have these other states, you've got rural areas of these other states that are having outbreaks like nobody's business. Now, it is because we are the highest risk state in the nation, and yet we have done the right stuff. And I don't mean from my standpoint, I mean from West Virginia's standpoint. And you've done a heck of a great job. Now, what we need to do is bridge the gap and come back to work as fast as we possibly can. Because I would be the first one to warn us all that absolutely we do not want the effects of not coming back to work to be greater than the disease. We're going to have to learn real soon how to live with this disease until we have drugs that will suppress the disease. I had a conversation last night with the chief cardiologist at Johns Hopkins. And here's exactly his words, were identical to what I've been telling you. He said, we've got to come up with a medicine that will turn the life-threatening part of this disease into a severe cold, to where that medicine will reduce the likelihood of death to a cold. And then we're going to have to wait on that medicine to bridge us to a vaccine. And once we start down that path, we'll be able to open everything and come back into a lifestyle that will be just like what we hopefully had before. Now, we'll probably still wash our hands better, maybe not shake hands as much and all that kind of stuff, but we'll go back to a life of normalcy. Now, with all that being said, I would be the first to tell you just this. Our country cannot endure the engine not running. The engine has to run, or we will ultimately drift into a depression and we will lose 100,000 times as many as we're losing now. We've got to go back to work. I get it better than anybody on the planet, and I'm going to push us in that direction to the limit of protecting our people. And we're moving as quickly as we possibly can, and we're moving very, very, very quickly. And so we'll get our hospitals up. You'll be hearing more and more rollout of more and more things that we'll be doing. And we've got the testing capabilities and the tracing capabilities to be able to stay on top of it and everything, and the strike forces to be able to get to a hot spot real quickly and everything. And we'll be able to do more and more and more in the days to come.
All right, thanks, Mark. Next, let's go to Annie Moore with WVVA.
Hi, Governor. It's Annie with WVVA. It's my understanding Wisconsin had 19 different people test positive as a result of the primary. Have you given any more thought to delaying the June primary?
No, I really haven't, Annie. I think my comments about this are just this. All of us, if we were really fair, would say we want to have people to be able to come to our polls, and we'll be able to have a June 9th primary, and we'll be able to have poll workers, and we'll be able to have distancing and protect our people, and hopefully by June 9th everything will be just rolling around, and we'll be in great shape. I think from the standpoint of Wisconsin, their surge is close upon us, closer than ours was, and all that, and so I think that's an issue that is a little different in our situation. But the other thing I want to add, Annie, is just this: is we all know that doing things, first of all, we have to have an election, by June the 9th, because we're going to run into all kinds of problems with other elections and people being appointed, boards of education and all that kind of stuff. So we got all that to be, so we're going on June the 9th. But here is the thing. We don't want to go by absentee. And the reason we don't want to go by absentee is all of us know the level of potential corruption from purely absentee is rampant. We want the right to be able to go to the polls and do what we've done in wartime and everything else. And that's what we're going to be able to do. Now, if someone has a legitimate reason why they have to vote absentee and everything, I would encourage to do so. But I would first and foremost tell you, we're going to our polls on June the 9th. We're going to make it safe. We're going to make it a good experience for everybody, and our clerks are going to be prepared to protect our people and do all the things they have to do. They're doing great work, and our Secretary of State, Mike Warner's doing a great job. We're going to be good. We're going to be good to go. June the 9th, we're going.
All right, thanks. We have time for one more question. Let's go to Kara Lofton with West Virginia Public Broadcasting.
Hey, Kara Lofton from West Virginia Public Broadcasting. Governor, you talked a little bit about this yesterday, but when we're looking at, and you talked about a little bit today, but can you outline for us what would have to happen in West Virginia specifically for us to reopen the economy? Are we following the guidelines President Trump set out, or are you working on developing your
You know, I answer these questions a lot of times, you know, and I don't do this sarcastically, you know, in like, how do you like your eggs? Or, sir, would you like your eggs scrambled or fried? And the answer is yes. We're absolutely following the guidelines of the federal government. We're following the guidelines of all the experts that are around me. We're following the guidelines of myself and all the information that I can gather from everybody, even down to the head of cardiology at Johns Hopkins. You know, I am consulting with everybody across this nation in every way to make the right decisions for West Virginia and to bring us back as quickly as we possibly can. We know the engine's got to run. There is nobody in West Virginia that wants to bring us back any faster than me. But at the same time, I'm not going to bring you back if I can't protect you, or at least protect you to the very best of my ability. We all know that there's going to be risks. There's going to be some level of risk. We can't eliminate the risk until we have a vaccine. That's all there is to it. And we won't probably have a vaccine for a year. And in fact, we may not have a vaccine for 2 years. But we will have drugs that will suppress this into what we think is going to be maybe a common cold. And but we've got to be able to find a way to live with it and get ourselves back. And but I'm listening to everybody. You know, that's my job. I mean, my job is not to just have an opinion. My job is to listen to the experts and do it right. And that's what I'm going to do.
All right, Governor, I'll turn it back to you.
I don't really know that I've got a whole lot else to bring up. I would like to just say this, that you know, and these things kind of get lost in the shuffle, but as we have begun to test significantly more people, our trend line now is at 3.47. That's really good stuff. You know, we've had, by my sheet here, we've had, you know, our positive cases look like the last 3 days that we're trending in the right direction. We had one day where we blew up sky high because we had all those at the Wayne County Nursing Home and the Jackson County Nursing Homes come in, and that was, you know, a few days back. As far as our percent of population that's being tested, I am really proud about this. In West Virginia and all the bordering states, Virginia, Pennsylvania, Ohio, Maryland, and Kentucky, we are testing at a rate significantly higher than any of those states now. And we are testing on a percentage basis of population significantly higher than the U.S. is testing across the whole country. So there's lots and lots and lots of numbers that are good. I only would end by always telling you just this, and I can't be any more sincere about this than to tell you just this. We've only lost 29 people in the state of West Virginia. We are absolutely trending at a rate of 3.47. We are absolutely testing more than anybody with our border states. We're doing lots of stuff. But those 29 people got a name. Those 29 people got a family, a lot of good friends. And we hate it, and we hate it terrible, and it's 29 too many. Anyway, thank you so much.